It
right?
does.
Yeah.
And on the payer side and the provider side, because we would get very angry providers, what takes so long to, approve this, or what takes so long to review it, and they don't understand the process in which to review it. Not only is it to get the request in, but to process that request and what it takes to process a request. So now we're receiving less phone calls from providers. We're receiving less phone calls from the members because, of course, the members are going to call us when the providers are not happy. So I think it's a win-win.
Yeah.
Across the board. The providers are happier because we're not spending as much time to approve a case or deny a case or just review a case. So they're happier with that. They're happier that they're not receiving as many denials. And once again, when they do receive denials, we don't have a lot of peer-to-peer reviews that are required or requested because it makes sense what we're saying. We're not just saying, well, it's denied because it doesn't meet medical necessity, but this is why it doesn't meet medical necessity, because based on the evidence, X, Y, and Z has to occur, or X, Y, and Z shouldn't occur. So, they're just a little bit more softer. I'll say that.
That's great, yeah.
Yeah.
It makes your life easier too,
It really
right?
does. And it's not just about making my life easier. We are here to serve the member. We're here to serve the patient. So it's not about us, but it's definitely a benefit. It's definitely a plus. And when we do what we do that because of the patient that we serve. So it's not about us making our lives easier, but it's making that patient's life easier. They're not going through unnecessary procedures. They're not staying in the hospital longer than they really want to stay. Because quite often, it's assumed that patients are there for an extended amount of time because they want to be there. There's people there to serve on them, hands and foot. And there are patients that just do not want that. They want to have their questions answered. They want their ailment fixed, and they want to go home to their family. So, it's making their lives easier too.